So the types of back pain conditions that we treat here at our San Francisco clinic include disc herniations, facet syndrome, lumbar sprain strains, and just your day-to-day backaches from sitting for too long or sleeping incorrectly, and much, much more. So there are two different types of back pain. There's the upper or mid back pain and the lower back pain. The treatment differs slightly chiropractically with the adjustment technique for a mid to upper back pain compared to a lower back pain. The lower back pain may include a side posture adjustment, while an upper back pain may be one where you're on your back or on your stomach. Acupuncturally, the treatment also may change just slightly depending on the area of where your pain might be. Now, there is a difference between conventional medicine and holistic medicine. And in the conventional medicine route, usually we see a cocktail of pain relievers, inflammatory reducers, and a muscle relaxer being prescribed to the patient, which doesn't necessarily cure the pain, but can help the patient manage the pain. While in chiropractic, we try to get to the root of the problem, which could be a stuck joint, it could be a muscle sprain or strain that we can really focus on. Chiropractors treat the back pain in a few different ways. One of them is chiropractically using a chiropractic adjustment. And that is what we call an HVLA, or high velocity, low amplitude thrust at the specific joint that needs to be basically unstuck. And we get to these sticky joints by a feel or touch approach. While we may also incorporate other soft tissue techniques that could include a Graston technique, or it could include a more hands-on manual therapy technique, such as active release technique. Chiropractors will use a palpation technique to feel for where the joint is more stuck, where there's inflammation built up. And this is something that chiropractors work at through training, through their schooling process. The first 2 years of chiropractic school are very similar to medical, where we do our textbook. The following 2 years, we go on more into a hands-on approach, where we're feeling, touching for stuck joints and inflammatory areas. And that's where we get our diagnostic skills in knowing where we're going to be focusing on for your treatment that day. So just like most medical therapies out there, there are sometimes some side effects that can occur from adjustments. That could include everything from a localized area of pain, sometimes an extra soreness. But we do explain that in detail, knowing that, hey, there are some side effects, especially if we're working on an area that's already inflamed. The muscle sometimes, or the joint, pushes back and gets a little bit angry. And we always recommend palliative care at home, such as icing and stretching, that can help accompany any of the side effects that could occur from an adjustment. So depending on the type of back pain, the prognosis or relief period can change. If it's a more acute strain of a muscle, you're going to probably notice a little bit of a faster relief and faster recovery time versus a chronic, more disc herniation that could occur from just repetitive stress at the area over a period of time. If you've waited too long to come see us, that can actually increase the length of time for you to get better. And so there is no set fixed amount of time. Our goal at our San Francisco clinic is to get you out of pain as quickly as possible. And we do that using the techniques that we have at our disposal, but also giving you some homework, which could include stretches and exercises, corrective exercises that can really help bring everything all together. Question like that quite a bit. Once I go and start seeing a chiropractor, am I going to have to see them forever? And the answer is of course always no. You can definitely stop, and some of our patients do after that acute period of pain. Once we get them out of pain, great, and they may not be back until their next injury. Certain conditions, require a longer period of care, but after our care and our patients are well educated on the benefits of chiropractic, they a lot of times choose to come in for something called wellness care, which can be as frequent as once or twice a month, and coming in just to get the body checked. I like to kind of relate it to going to the mechanic to get the car checked. When you see that check engine light on, it's time to get the maintenance, and think of coming to us as that check engine light. Another great example is going to the dentist to get your teeth checked for cavities. That's important because it's a preventative measure, so that way the cavity doesn't turn into something more serious. And that's what we do as chiropractors, is we're going to go ahead and take a look at the spine. I mean, think of the spine as kind of the hard drive to a computer, and it connects to everything. And so looking at the spine is super important. If the spine were on our face, we'd probably be paying more attention to it, but since it's in the back, we don't really get to see it too much. But this is what we're here for, is as chiropractors, we're here to actually look at the spine to see what areas are stuck, see what needs to be changed, where the pressure needs to be released, and then basically we're getting to work on that, just like other professionals might with different types of professions and conditions. Here are 3 reasons why you should see a chiropractor for your back pain. It's interrupting your sleep. You've had back pain for a very long time, months to years, and you've tried other therapies that just haven't really worked yet.